Good afternoon, everyone. Thanks for joining us today. Today, we would like to share with you some information about the lead testing in school and child care program here at the Texas Commission on Environmental Quality. The goal of the webinar is to share information with water systems about how they can support schools and child cares to get involved in the program. If you are a school or child care facility who has never participated in one of our webinars, you should still stay on because there's valuable information here for you today as well. Okay. You can visit our website at texasleadtesting.org to learn more about the program or to find our contact information. You will also there's also a place on there to contact us. I'm sorry. Also in the Q&A is a place where you can see our contact information as well. And then in the chat section, there is a link for promotional information packet in there as well. My name is Claire Carlton. I'm the team leader for the Drinking Water Assessment Team here at TCEQ. I'm joined today by Nicole Ruiz, who is the program coordinator for our program provider with Trupani Incorporated. We're very fortunate here at Texas to have Trupani as our program provider. They have extensive knowledge in working here at Texas and also in other states throughout the nation. They've done an amazing job setting up all of our participants for success within the program. I'll get started here and cover some program benefits and achievements. Then I'll turn over everything to Nicole, and she'll dive more into program overview, key findings, how the program can help you, and then lead and copper rule, some information about lead and copper rule improvements. And then, like we said, we will have some time for Q&A at the end of the presentation. So program benefits, let's talk about that. What's this program about? It's a free voluntary program to help Texas public schools, K through 12, and state-regulated child care facilities test for lead in drinking water and take action to reduce lead where children are served. The program offers no-cost training, support, and sampling analysis. We provide technical assistance and ongoing support for participants throughout the program, and all materials and instructions are included and delivered directly to participants. Program funding is made possible from the Water Infrastructure Improvement for the Nation Act. Section 2107. The grant is administered through EPA, Environmental Protection Agency, and is called the Voluntary School and Child Care Lead Testing Reduction Grant Program. The program follows guidance from EPA 3Ts for reducing lead in drinking water in schools and child care facilities. The 3Ts includes training, testing, and taking action as the primary steps for reducing lead in drinking water. Our program webpage, under external resources, there's a link on there that also can lead you to the EPA 3Ts if you'd like to learn more about that. A little bit about the program and our outreach. So we the program prioritizes communities with low median household income, 50% free and reduced lunches, children under the age of 6, and then early Head Start facilities. We prioritize those communities, but nobody's going to be turned away from the program, so we encourage everyone to join. The program participates in conferences. We hold webinars, provide educational sessions for schools, child care facilities, and community groups and water systems when we can. We also put out social media promotional information on the TCEQ Facebook page and Instagram, so you can find information about us there. And then, like I said, we have a promotional packet, which we have put in the chat today, that's available for you to use moving forward if you'd like to share information with your community. Online resources. So like I said, you can visit our website to access online enrollment forms, access the public results portal, sign up for upcoming webinars. There's news and information about there. You can schedule a meeting with us and learn more about the program all on the website. One thing to note for the online enrollment form is if you have a lot of facilities that you're wanting to enroll, you can always reach out to us through email and let us know that. And there's kind of a more efficient way to do that if you have a lot of facilities you want to enroll at one time. So reach out to us if you need assistance with that. The results portal, so that we have a public results portal. It's on our website, as mentioned, and then on that public results portal is where you can get view results for facilities that have completed sampling through the program. You can also export that data and use it to help determine who is participating in the program and who's completed sampling in the program. So that's a really cool resource to have to learn who is participating in the program and sampled. Here are some achievements. So we're really proud of what the program has been able to achieve so far. So as of the 5th, we have over 4,000 participants in the program, 2,300 schools and 1,600 childcare facilities. Over 700,000 children have been served by these, served at facilities that have completed testing. 44 plus thousand samples have been collected and analyzed, and over 5,000 pitcher filters have been sent out for outlets that detected lead. One other thing that I wanted to share with everyone today is we've created a GIS map for all the facilities that have sampled under the lead testing in school and child care program. So if you, for water systems out there, if you know your water system boundary area, you can use this map and view participants that are participating in the program and are within your boundary. On this map, you can click on icons for each facility, and it provides the operation number, the name, the address, the type of facility, the age served, and the number of outlets that were sampled. So I will pull up that link and we can take a quick look at it so that way y'all can see what that looks like. Might take a second to load, hopefully not too long. So as you can see, it's a map of Texas and then all the different facilities on here. So here on this side, you can see the schools are in purple and childcare facilities are kind of green. So you can zoom in. We'll just kind of zoom in to an area here and take a look. So if we zoom in here in Waco, we could see if we click on this child care facility, it'll pull up the information about, like I said, the operations number, the facility, their address, if it's a child care facility, the ages, and the number of samples that they've collected. So that's really helpful information. You can also click on this link to go to the results portal and then use that operations ID number to find the facility as well. So that's really helpful information we thought we would share with you today. So program benefits. There are so many benefits to the program, but this is, just a few of them. The program fulfills LCRI requirements for schools and childcare sampling, but it really exceeds those because of the number of samples that a facility can collect through the program. It provides free sampling materials, training, and laboratory analysis from a certified lab. It is designed by a team with extensive EPA 3T sampling experience. It provides technical and communication support daily, increases trust and transparency with schools and childcare communities, and best of all, reduces lead where children are cared for. I'm going to turn it over to Nicole from Chupani, and she will cover the remainder of the presentation.
Thank you, Claire. So now we're going to go ahead and get into the program steps for lead testing in schools and childcare programs. Next slide, please. So we break this program down into 6 steps, but prior to getting into like the details, I just wanted to highlight that each of the steps in this program that have a green star next to it is a step that we can provide on-site support for via our technicians, just to expedite the process and support anybody who is working in the program to go ahead and complete it at a very much easier. So facilities first enroll in the program. As Claire mentioned, this enrollment can be accessed on our program website. However, we are able to support facilities by processing enrollments over the phone, or as Claire mentioned, for larger school districts and childcare agencies, we're able to provide bulk enrollment support, and that makes the process a lot more accessible. The next step is completing the program training, and this training is a self-guided training that's less than 10 minutes and provides information on both lead and drinking water, as well as information on the program. Following the program training, the facility will notify the community of the upcoming sampling event. We provide a letter template, and facilities can use this both in English and in Spanish. And this gives stakeholders an understanding of the importance of testing and why the facility is taking this proactive step. Next slide, please. Following the community notification, we will then collect an outlet inventory. We're able to sample all outlets used for food preparation, drinking, and teeth brushing. We provide guidance to sample event coordinators on how to collect this inventory and ensure each outlet is unique. Following the outlet inventory is a short sample collector training that is also self-guided and provides the information necessary for the person collecting the samples to feel confident in the sample collection process. We then ship the sample kit and provide all the materials necessary to collect samples and send them back to our accredited lab. Once those samples arrive at the lab and are analyzed, we then send the results along with an action plan to the facility. Next slide, please. Great. Now I want to share some information on our sampling protocols. The sampling for this program is 250 milliliter sample volume. We have a 8 to 18 hour stagnation period, and we have those outlined in our sample collector trainings as well as in our sample kit materials. We use first draw and flush samples depending on the size of the facility, and we're also able to provide follow-up sampling as well as multiple rounds of sampling if a facility is interested. These samples can be collected by anyone that has completed the training, and this includes the point of contact at the school or childcare facility, maintenance staff, our field technicians, or even personnel from a water system. So step 6 in our program is results and taking action, and I just wanted to highlight a bit more about this step. Every facility receives an action plan regardless of their results that provides information on remediation options. Although there is no action level for schools and childcare sampling through the LTSCC program nor through the LCRI, we do provide guidance for how to take action based on facilities' results. Additionally, we're able to provide follow-up sampling for any outlet that has results of detectable lead, providing more information about the source of lead and further informing remediation options. One highlight is that when funding can now be used for remediation, our program can provide lead-free fixtures and filters when lead is detected. I'll talk about these control measures a bit more on the next slide. So given that WIN funding can now be used for remediation, our program is able to provide support with control measures. Through our program, schools and childcare facilities that detect lead may be eligible to receive pitcher filters, inline faucet mounted filters, lead-free fixtures, drinking fountains, and our bottle filling stations. We work closely with the sample event coordinator to provide technical assistance when selecting the control measures and then also coordinating the delivery of these products. Next slide, please. Next, I want to highlight some key findings from our experience in this program. So our team has built a list of over 26,000 schools and childcare facilities from a variety of state agencies, and this has given us a robust database of schools and childcare facilities to reach out to and provide information about the program. We've learned some things in regards to how to engage with different facility types through our experience, and I wanted to make sure I highlighted these outreach findings because as you begin reaching out to facilities through LCRI work, this information can be helpful. Next slide, please. What we've found is that for larger school districts, especially larger ISDs, they're much more likely to enroll at the district level, given the coordination and the need for district approval for these facilities to move through the program. Often the best point of contact we found is the maintenance personnel, and due to the nature of their job, they're best reached via phone. In regards to childcare facilities, these are much more likely to enroll on an individual basis, just given the way leadership is structured at these facilities. We found that letters, emails, and postcards are more effective than phone calls during business hours, just given the nature of the workflow at these sites. Typically, the people that would oversee the program are in the classroom supporting their staff. So during business hours, it can be really challenging for them to get to the phone or catch them at a good time when they're receptive to hearing about the program. Another thing to consider is the high turnover rate at these facilities. Facilities frequently are opening and closing, and there's often frequent staff changes. Next slide, please. Over the course of this program, March 2025 is this updated record. We've collected over 35,000 initial first straw samples at schools and over 5,000 initial first straw samples at childcare facilities. Typically, schools are larger than childcare facilities, and the average number of samples collected at schools is 32, while at childcare facilities, it is 8. What you can see through the numbers is that we're typically collecting a lot more than is required through the LCRI school and childcare sampling. We looked at the data at different levels, and we know that there are no safe levels in lead in drinking water, but of course, 15 parts per billion historically has been a commonly recognized threshold for taking action. In regards to results from our initial first straw sampling, 2.4% of the samples from schools come back at or above 15 parts per billion, and for childcare facilities, that's 1.5%. Looking at facilities that have at least one location at 15 parts per billion or higher, we're seeing that it's just under 30% and of the schools, while at least one outlet came back 15 parts per billion or higher for just over 6% of the childcare facilities. Looking at the program data by outlet type, the most common outlet types we collect samples from are drinking fountains, kitchen faucets, and classroom faucets. Through the EPA 3T's 250 milliliter sample protocol, it is designed to capture fixture level lead, and it is important to communicate that to the information to the facilities prior to sampling. But what we see is that 79% of the time drinking fountains are less than 1 part per billion or non-detects, compared to kitchen faucets and classroom faucets. When we see detectable levels of lead, we typically see it more often in kitchen faucets or classroom faucets rather than drinking fountains. The drinking fountains include bottle filling stations and water coolers, which sometimes have filters already in place, and that could be one of the reasons we see less lead in these types of outlets. Now I want to talk a bit about how our program can support you and your water system. So starting in 2028, water systems under the LCRI school and childcare sampling must offer sampling at least twice to elementary schools and childcare facilities they service, and sample 20% of those each year for 5 years. Secondary schools can sample upon request. Results from sampling must be provided within 30 days to the facility, state, and local health department, and sampling through the WIN-funded programs that occur between January 1st, 2021 and November 1st, 2027 does count towards the sampling. And that is all to say, next slide, please, that sampling through the LTSCC program now meets LCRI requirements, and we are encouraging people to participate now to get ahead of this requirement. So what does the school and childcare sampling require through the LCRI? Again, school and childcare sampling is required beginning 2028. Under the LCRI, 5 samples must be collected from schools, and those outlets locations are predetermined by the LCRI. In childcare facilities, there are 2 samples required, and again, those locations are predetermined. Although, additionally, through the LCRI, there is a school and childcare notification requirement, and the consumer confidence report must include a statement about the opportunity to sample. The LTSCC program is available to facilities now. It is a WIN-funded state program, and through our program, we're able to sample all outlets used for drinking or food preparation, which exceeds the 5 and 2 location requirements outlined in the LCRI. And lastly, our program has community notification requirements that was outlined during our program steps. And again, I just want to reiterate that sampling now through the LTSCC program meets the LCRI requirement. Next slide, please. So talking about stakeholder engagement, our team works really hard to reach out to program participants through a number of conferences, presentations, webinars, as well as direct outreach. We partner with key stakeholders such as water systems because we value those partnerships. Our program name may not be as familiar to childcare facilities or schools, but they definitely recognize their water system. And this just develops a deeper trust in the program when they see that we're partnered with organizations that they recognize. Next slide, please. So as I wrap up here, I just want to highlight a few of the aspects of this program that are valuable to participants as well as water systems. One of those is the sampling assistance. We're able to send sample kits directly to facilities where the participants can collect samples as they have time, or we're able to schedule on-site sampling and send a technician to complete the outlet inventory, as well as sampling, which saves the participant time, especially at those larger facilities. Last summer, we were able to coordinate with a number of school districts across the state and send out our sampling technicians, where they sampled over 400 schools, which ultimately alleviates future sampling requirements for those water systems under LCRI. Next slide, please. Great. The last program highlight I wanted to reiterate is the free control measures through the program for water locations with detectable lead. Our program helpline and our communications template can support facilities as they communicate with their stakeholders regarding results and their efforts towards taking action. Through our program, we've been collecting information from participants that have completed sampling and what actions they've taken, if any, to reduce lead. As of April 2025, we've collected remediation information from 66% of the facilities that have completed sampling. Through this program, participants are taking an active role in reducing lead in drinking water. And so with that, I've concluded my portion of this presentation.